And welcome back. This is, of course, Bob Williams, and you're listening to Upfront Outspoken, where we talk about all the issues. What can I tell you? This is going to be a very great segment. You don't want to go away, because on the phone I have a very special guest, and we're going to be talking about the enterovirus EBD68. And according to what we heard as of September 11th, more than 80 cases in 6 other states, Colorado, Illinois, Iowa, Kansas, Kentucky, Missouri, have been confirmed to be with EBD68, along with the possibility of several cases in New York. And also, on Thursday, media reports of kids flooding ERs in Alabama and Washington State spoke to the spread of the virus. Other states, including Michigan, Georgia, Ohio, Utah, and Oklahoma, are also investigating clusters of respiratory illness. Several have sent samples to the CDC for testing. On the phone with me, of course, as I promised, is Dr. Kristy Bradley. She is with the Oklahoma Department of Health. And Kristy, if you listen, folks, her voice is going to kind of raspy because she herself, I don't want to say this, but she herself may have caught this particular virus, and it is. Hello, Kristy. I thank you for taking the time to join us this morning.
Well, good Monday morning to you.
Now, Kristy, we have heard so much about this EBD68, and that the first reported cases came in 1962 in the United States, and we haven't heard anything about it. But from what we have been told, have been heard on the news, there is no, correct me if I'm mistaken, but there is no known vaccination or cure for this particular virus. Am I correct?
That is correct, which is true for most of the enteroviruses. There are over 100 different types of this particular virus, and they're circulate at different levels during the cold and flu season and cause varying degrees of respiratory disease amongst children and adults each year. But this particular strain, the EBD68 strain, is considered pretty rare, and it's never been known to cause any outbreaks of illness in the U.S. before this year.
Now, from what reports that we're hearing is that when I talked to Linda Hammond over here at the LaFleur County Health Department, I'm certain you've had more updates. She said to us right there when I interviewed her on Friday, she said that we do have clusters developing in Oklahoma City and Tulsa that could be related to this EBD68. Now, being in the health department yourself, right at the capital city of Oklahoma City, have there been any reported cases of this particular virus now in these 2 affected areas?
Well, we started hearing reports from our children's hospital in Oklahoma City in mid-August that they were seeing a concerning number of children that were being hospitalized for what looked to be like a very severe asthma attack. But they didn't respond as is typically the case. So they made us aware, and then coincident with that, we were hearing about what was happening in Illinois and Missouri, and so we've been tracking that. It takes very sophisticated laboratory testing to tell specifically if a person's infected with the D68 virus, but we do have the ability to do a screening
right.
In regular labs for just, are they infected with enterovirus, yes or not? And we are certainly seeing a large proportion of the specimens from these kids that are really sick screening positive for enterovirus. So we've sent a shipment of approximately 20 samples to the CDC, and we're expecting confirmation hopefully this week. And I would strongly suspect that those are going to come back positive.
So we can expect that now. From what you are telling us here, you're saying that we can almost expect that this particular virus is now indeed here in Oklahoma.
That is correct. We've been seeing the increase in sudden onset of severe respiratory disease in some kids, leading to hospitalization. In central Oklahoma, those hospitalizations have increased 2 to 3-fold. Tulsa has not reported that early on, but it's only a matter of time before this virus starts spanning out really literally across the country. So that doesn't mean that everybody should panic that we have it here. I think it's just very helpful to be aware that most likely we do, and that we are seeing a pattern and initial findings that are consistent with the EBD68 outbreaks. And parents should just be a little extra cautious when their child starts to develop what looks like a cold, because in certain kids this can change very quickly, where they go from just a runny nose, kind of fussy, to all of a sudden having a lot of difficulty breathing, and that's when it can be serious. And if parents start to hear that wheezing, or they just see that their child is really working very hard to breathe, that they shouldn't delay and take their child to an emergency department or to a physician as soon as possible.
Now, we've heard reports that as much as like 15% of the reported cases that have developed of a respiratory ailment in Kansas City these patients have ended up basically in intensive care. Now, given the fact that we now have it, and once again, I want to tell everyone out there, it's not been 100% confirmed, but it seems like we do have the EBD68 virus here in Oklahoma. Has there been any reported cases of children here in Oklahoma that have gone into intensive care that they suspect was caused by the EBD68 virus? Do you have any knowledge of that?
Yes, I do. There have been some children that were very sick, hospitalized in the ICU, put on different levels of oxygen support breathing machines to get them through this infection. And again, not confirmed as EBD68, but ones that had the typical clinical picture that we are hearing from other states, and they had a respiratory specimen that screened positive for an enterovirus.
Now, I heard from Linda Hammond. Once again, she was very, very nice when she was talking to me. Now, she told me that the normal flu season is generally from, I believe she said September, till the end of February, early March. Now, this particular virus has already come up here in August, which is earlier for any type of enterovirus to be coming in our direction. My question for you is, when do you suspect I want to say a loosening of when we can expect not to hear so much about this EBD68 or any enterovirus for the remainder of the year? Do we expect in the end of February, or is a potential it's going to go well beyond that?
Well, we don't know, since we've really never tracked an outbreak of this particular strain of enterovirus, if it will move through the population more quickly, or whether it'll have a slower, more deliberate spread as it affects people. We also don't have a good understanding of the spectrum of illness in adults, especially older adults. So we're monitoring long-term care facilities to see if there's any evidence of outbreaks that might occur amongst an older, more vulnerable population too. Enteroviruses in general tend to be more prevalent in late summer, early fall. So this particular timing is very classic for an enterovirus.
And when you had mentioned, excuse me, normally we are seeing the enteroviruses generally affect the younger population or the extremely elderly. Now, we're finding, through the reports we're getting, this particular enterovirus is going all the way across the spectrum. So it seems that from what we've been finding is nobody is going to be immune to this particular virus in comparison to, past flu viruses where you could just go out and get a quick remedy at your local pharmacy. It seems that anyone between the time of infancy to the time of being elderly that might have a lowered immune system due to maybe even just a simple cold are going to be more susceptible to this EVD68. The question I have is how can people, basically take the precautions to not get this thing?
Well, it's difficult because, as you know, respiratory viruses are pretty hard to stop in their tracks, but primarily it's just being more vigilant about good hand washing. And here's some important point, Bob, that these particular viruses are resistant to the alcohol hand sanitizers that we all like to use and put in our purses and cars and things. And so this is where washing your hands with soap and water for at least 20 seconds is really the key. The virus is spread through the respiratory droplets of an infected person that come from their nose and their mouth. And it may also, in very young children, be spread through the stool. So we're encouraging daycares to really be extra vigilant about wiping off their changing tables frequently and cleaning surfaces that are touched frequently by children, like toys and doorknobs and desks, very often to help slow the spread of the virus.
The other question you brought up earlier, the fact that you already have several samples sent to the CDC of potential cases here in Oklahoma. And when I had asked Linda in reference to this, she said that, number one, it takes about 6 to 10 days in order to get these test results back. Well, I had asked her a very poignant question, and to be honest with you, I think her answer was a little aloof, but she tried her best. I'll give her that. So I'm going to ask you, working right there in the heart of all this, if a person goes to the hospital, they have a little bit of a fever, but they're not symptomatic per se of a serious case of this particular enterovirus, and they are sent home. Okay, is what she told me. Given today's environment, when people, even though they may feel a little down, a little bit out, I got the aches and I got the pains, but I got to get this work done. She said that the doctors advise them, number one, stay at home, don't go anywhere. Anybody that comes into your homes, give them a mask. Well, given that the fact that today's society, that these people are still going to have to go out buy groceries, they're going to have to pick up their kids from school, they're going to have to do this here. Aren't we asking for more trouble if people don't adhere to what the doctor says?
Well, we certainly always suggest that people who have any sort of a respiratory virus try to distance themselves from others to the extent possible, including staying home from work and keeping your child out of school or daycare so that they don't share their germs with others. Right now, this does appear to be primarily affecting younger children, but children who have asthma or children who are under the age of 5 are the ones that are most vulnerable to getting the severe complication with the asthma type of attacks where they just can't seem to get enough air.
I don't mean to interrupt you, but the children under the age of 5, these are children that are either in kindergarten, maybe first grade to daycare. Am I correct?
Correct.
Okay. Mm-hmm. All right. So we're seeing this more in that age category, at least for the moment. But are we seeing it also starting to affect adults?
Well, we think that, like you mentioned before, that because this virus is so rarely circulated in the United States, that most people across Oklahoma bunch of different age groups are going to be susceptible because their immune system has not encountered it when they were young, and didn't have time to develop antibodies like we do to so many of the other common respiratory viruses. But, this investigation at the national level as well as the state level is really just in its early stages. And this is one of the big questions that we have is how is that affecting older children, adults, and older adults. And so that's going to be part of the epidemiologic investigation as we try to better characterize what the full spectrum of illness is across the different ages. But we're only hearing primarily of the hospitalizations and real severe disease in children, and especially younger children.
Wow. So, I mean, this particular virus seems to be one wherein we don't have a cure for it, unlike some of the other where you go to the doctor and you simply get a flu shot. This one here seems to have, how should I say, teeth of its own, and it's going to go on its own way. Am I wrong in the assumption that if people do not take these precautions that you are recommending, that this thing could stick around with us well past this February normal deadline that these viruses go away?
Well, I think we will. It'll be interesting to see when we have the peak. Other states that experience this earlier, they are starting to see a decline after 3 to 4 weeks. So I think it's reasonable to say that it could circulate for a period of several months. But it's a funny thing in the world of viruses. They compete with each other.
Right.
And as we have more of the other respiratory viruses start entering the picture, like adenovirus, parainfluenza virus, influenza, they have a tendency to compete with one another and kind of get out of the way. And so I think as we get further into the respiratory season and these other viruses start to dominate, that the enterovirus incidence will decline.
Well, I thank you for coming on, Dr. Bradley, and taking this time. I know you yourself, you're not feeling very well, and I'm hoping you do not catch this EBD 68. And
I hope that's not what I have. I don't want to be part of the spreader population.
Well, I'm hoping that your department would please keep us in mind of the developments, and if this thing does indeed blossom a little bit bigger, I would love to get you back on the air.
Oh, I'd love to do that. And I just don't want anybody to panic about this. I mean, yes, it is a newer virus, and it has the potential to cause some severe problems, but most people who get it will be expected to process it like a normal cold, and they will get better. So just practice your cough and hand hygiene, and I think we'll all get through it.
I think so, too. Thank you again, Dr. Bradley. I know it's so early in the morning. Thanks for coming on the air and keeping us up to date with the latest about this virus, and I hope to get you back on soon.
You're welcome. Have a great day.